Alright guys, the other day I was asked to do a video about a restorative nursing assistant. Kind of got me thinking about the specialties that you see a lot of nursing assistants in, and the fact that they're not really certifications in those specific fields. They're typically just sort of on-the-job trainings that you obtain while working for these facilities. So since the question was brought up, I figured I would answer the question, but also give my insight on some other things, more specifically specialties that CNAs can get into. Now, there are as many CNA specialties as there are anything. You name it, there could be a CNA that is specialized in that, typically. But some of them are, like a cardiac CNA, a mental health CNA, not dialysis because they use techs, but ICU CNA, critical care CNA. But typically when you get into that, they're called techs. So it'd be like a critical care tech or a critical care assistant, something like that. In any case, there are tons and tons and tons of CNA specialties, not really certifications, but they're sort of specialized in these individual things. I'll talk about a few that I have done. I've only done two. And of course, the restorative. We'll get to restorative first. Typically, it is done in a rehab unit, not like drug and alcohol rehab, but more like rehab if you have a stroke and you need to learn to walk again, or a knee replacement, and you need to learn how to bend that knee again, and things like that. These are probably the most documented CNAs, as there are a lot of movements that you have to document that you do, especially on someone who's like a hip replacement or something like that. You got to rotate those people every 2 hours, and you kind of got to document where the pillow is, and document how you turn them and how they were when you turned them. If they showed pain, didn't show pain, things like that. Probably, I could be wrong, but probably the most documented area as a CNA would be in a restorative care setting, as you are typically going to be the one that does a lot of the movements, not the initial movements. The initial movements, of course, going to be some sort of physical therapy or occupational therapy, but the rehab CNAs, they do work just as well. You're not going to be sitting around doing nothing. So on top of your regular CNA duties, cleaning, checking, getting vitals, obtaining vitals, things like that, you're still going to be making sure these patients walk, making sure these patients use their walker, making sure these patients bend this knee or rotate this hip, or roll over in the bed, things like that. So you're still going to be doing quite a bit. And as I said, I think I'm probably wrong. I think it's probably the most documentation you'll do as a CNA, as you still have to document what they moved, when they moved it, how they did while they moved it, things like that. It's typically really just a checklist, so you just kind of check, boom, 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 move this, did good, was okay, something like that. But you still got to do a lot of that stuff, and a lot of that stuff is timed, like the 2-hour pillow rotations, things like that. Now, at least here locally, and typically, this is an on-the-job training position. This is not a position that you get and you go to school for like another 2 months or whatever, and then you become a restorative care assistant. But typically, you learn this on the job. That's the best place to learn, is you show initiative that you can learn, and then someone takes you aside and says, "Hey, do you want to be the restorative nursing care assistant," or whatever it may be, and then they'll train you on the job, which is, in my opinion, one of the best ways to learn, because you're already going to learn what you need to know on the job, as opposed to school, which teaches you a lot of things and then you learn more later on. But that is a restorative care assistant. Now, two types of nursing assistants that I was myself personally. Number one, I was a pediatric home health care aide. An HHA, but in peds. So a home health care aide with pediatrics. This, again, was on-the-job training. We actually had a recruiter come to our community college class while we were in school, said, hey, if you guys are going to nursing school, maybe you want to pick up some extra hours, come on down here. And it was actually for biota. If you know anything about biota nurses, they're sort of a national thing. They're everywhere. We got a bunch of them here in North Carolina. Biota is a great company to work for. They said, come on work for us. We'll recruit you straight out of this program and train you to our specifics and put you to work immediately. And they did just that. I went to about a 3-day, I think it was like a 3 8-hour day. It's hot today. A 3 8-hour day training where I learned, like bathing skills at these certain types of baths that I would see, certain feeding skills that I would need to use. I did not do tube feeds, but I did have to document that I looked at them. Looked at the sites for the tube feeds and the trachs. If I saw anything, I would notify my RN immediately. Whenever I had to document things like that. And it was, like I said, I think it was 3 8-hour days that I spent in the office just learning all these things. And then whenever I got out into the field, because I was in the home, they monitored me to make sure that I was able to fulfill the duties that were bestowed upon me and able to do the job. And it really wasn't that bad, but once I got my little HHA pediatric certification, home health care aide, PEDS, whatever it may be, I believe I got another $1 an hour, which was pretty good. So it definitely pays to get one of these certifications or specialties or whatever it may be. It was non-transferable, so I could not take it from biota and go to, I think of another Maxim is another, maybe that's just local. Maybe they're national, I'm not sure. But, I couldn't just go from biota to another home health care agency with that HHA PEDS. It really just stuck with biota. But, like I said, it got me another $1 an hour. Just simply by having that little certification thing that they made me do. So it was definitely worth my time to get that little certification for HHA PEDS, which definitely was good for me. And it really wasn't like that much more work. I didn't really work any harder. I just did more stuff. I got more hours at it as well. And it was pretty good. Now, the other type of certification I had as a CNA, I obtained at a hospital, and it was called a Cna Plus 4. Some of you may or may not have heard of this. I've heard it called critical care nurse assistant, things like that. Basically, it was a critical care nurse assistant, and I had 4 skills on top of my normal CNA duties that I could do that I was certified in. That was, again, a company policy, a company-wide certification. I couldn't take it with me anywhere I went. I had to stick with it in my company, but I could do 4 extra skills on top of being a CNA, which helped my critical care nurses. So on top of my vitals and cleaning and moving and changing and all these other skills that I had, I could also DC IVs, which was handy if a patient got a PICC line or something like that. I could not initiate an IV. I could not stick anyone, but, I could not stick anyone, but I could DC an IV. I could begin and DC a Foley catheter without complications. If it was going to be a complicated individual, I could not do it. Or if it was some sort of different catheter like a Cna, I could not do a Cna. I could only do a Foley. So I could do DC IVs, or DC just simply the needle, the catheter, the HEPLOC, whatever you want to call it. I could DC the HEPLOC. I could not DC the medication. I could only DC the HEPLOC. And I could begin and DC Foley catheters. I could also do very, very basic wound care. If the wound care required no medication, I could do it. So it had to be sort of like a prolonged sort of thing, so I could simply just do like a dressing change almost. So those are my 3 that I could do, and I had one more, and I want to say it was blood sugar checks. I could do blood sugar checks. As simple as that sounds, you still need to document the numbers that you get and sort of report off. And so they wanted me to be certified in that little area, the blood sugar checks. So those were my +4 that I could do as a CNA, and my little badge said NA +4 critical care or something like that is what my little badge said. So, you know, and I believe that made me another quarter an hour, something like that. It really was not a lot of money extra an hour. But if you get certified in anything that these CNAs can get certified in, it is typically more money. You simply just show the initiative that you can do the job, you want to do the job, and you're ready to do the job. And someone will probably take you out there to get you certified in that thing. So that's what I got for you on specialties in CNAs or nurses assistants, whatever you want to call it. If you like this video, check this one out over here-ish. Don't forget to like, share, and subscribe over here. I hope it helps. I hope I answered the question. Thank you much.